I used to think pain would be obvious. You stub your toe, you wince. You fall, you cry out. But with dementia, pain doesn't always look like pain. Sometimes it looks like refusing to eat, or pulling away when you try to help, or yelling for no reason in the middle of the night. And for the longest time, I didn't realize what I was seeing. I thought it was just the disease getting worse. But what I've come to learn is this: pain often hides behind behavior. And when words are gone, behavior becomes the only way to speak. Hi, I'm 𝗪𝗏𝗀𝗃. My wife Sonia was diagnosed with Alzheimer's in January 2020 at the age of 65. I've seen too many caregivers suffer physically, emotionally, and mentally, oftentimes more than the loved ones they care for. I was determined not to let this disease take me down, and I found a way to cope. Now I help other caregivers do the same. There was a day Sonia kept clutching her arm and tensing up every time I helped her move. No words, no complaints, just that same tense, guarded reaction over and over. It wasn't until much later that I found out she had arthritis flaring up in her shoulder, and she also had a UTI brewing. She couldn't say it. She didn't even seem to understand it. But her body was trying to tell me something, and now I pay a lot more attention to what her body says when her words can't. Pain shows up differently when someone has dementia. It's not always ouch or I hurt. It's agitation, restlessness, pulling away, yelling or crying out, refusing food, sudden aggression, or just a haunted, faraway look in the eyes. All of that can be painstaking. And the hard part is, unless I know what to look for, I might miss it. Or worse, I might think it's just bad behavior. But it's not bad behavior. It's unspoken suffering. Here are some of the most common hidden sources of pain I've seen in Sonia and other caregivers have told me about. Arthritis and joint stiffness, constipation, UTIs, toothaches or gum disease, muscle cramps, pressure sores or skin infections, inflammation in the brain, even old injuries flaring up again. None of these are visible unless I'm looking for them, and most of them can make someone with dementia feel agitated or scared, even if they don't know why. The hardest part? As a caregiver, I carry this pressure. What if she's in pain and I'm missing it? It's exhausting. It's heartbreaking. It makes me question myself all the time. There's nothing worse than watching the person I love suffer and feeling powerless to fix it. But over time, I've built a system that helps me spot pain sooner and speak up with confidence at doctor visits. When I go to the doctor now, I don't just say she seems off. I come prepared. I ask, could this be a UTI? Have you checked her joints? Can we look at her teeth? What else could be causing her agitation besides dementia? I trust my gut, and I've learned to advocate hard because if I don't, no one else will. Here are a few practical things I do that have made a difference. I keep a simple behavior log. If Sonia seems different, more agitated, more anguished facial gestures, less responsive, I jot down what I noticed, when it happened, and anything that might have triggered it. Patterns start to show up, and when they do, I take that info to her doctors. I do comfort checks. I'll gently press her arms, shoulders, or legs and watch her face. If she flinches, stiffens, or pulls away, I take that seriously, even if she doesn't say a word. I assume something hurts until proven otherwise. If she lashes out, I don't jump to discipline or redirect. I ask myself first, is this pain talking? Because usually it is. This journey has taught me one thing again and again. I have to be her voice. When she can't explain what hurts, I have to look deeper. I have to fight for her. And I have to forgive myself when I miss it, because I'm still learning too. This stuff is hard. It's not in the manual, but I've learned how to manage it without burning out. And that's what I teach inside the Caregiver Mastery System. How to navigate moments like these without losing your mind or your heart. Have you ever had a moment when you just knew something was wrong? Drop a comment below. What tipped you off? What helped you figure it out? Figure out that it was pain. If you're feeling overwhelmed, exhausted, or like you're losing yourself in caregiving, you're not alone. That's exactly why I created the Caregiver Mastery System, a step-by-step emotional roadmap to help you manage stress, anger, and burnout so you can care for your loved one without sacrificing yourself in the process. Inside, you'll discover how to say yes to yourself without guilt, reduce overwhelm, and reclaim peace, even in the hardest moments. I call this Heaven Island, a place of peace, clarity, and deep acceptance where you can show up for the one you love without losing who you are. And just so you know, this isn't some time-consuming program. I didn't create it to add more to your plate. I built it to take the weight off your shoulders. The lessons are short, practical, and easy to follow. And if you apply what I teach, even for just a few minutes a day, I guarantee you'll start to feel a real difference in 2 to 3 weeks. Click the link below or visit caregivermasterysystem.com to get started today. If this video helped you, please like, share, and subscribe. I post new caregiver support videos every Monday and Thursday. And if this message spoke to you, use the hashtag Caregiver Mastery so others can find the support they need too. You're not alone. Let's get through this together.